Mary was out to dinner with her friend, and they were sitting at a restaurant in Springfield, and one of our nurses who works for us was sitting at a table nearby with her husband, and her husband, sort of nudged her and said, there's a woman on the floor at the table next to us. And so Tama, being the kind of person that she is, got up and went to the aid of this person who was on the floor and held her hand and tried to assess what was happening with Mary, and made sure 911 was called and that there was emergency services coming, but basically tried to assess what was happening. Was she having a cardiac event? Was she having a stroke? Was she having some other issues, to try and help sort of process, so that when the emergency management team came, that she'd be able to help them sort of understand what was going on and facilitate getting this patient the care she needed as quickly as possible.
When I got up from the end of the table, I just landed on the floor. That's how fast it was. And then I really didn't know what happened. Next thing I knew is this little voice over here saying, "Mary, are you all right? Did you get hurt?" And I couldn't talk. Get kind of emotional. I do.
Me too.
I
didn't know where she was, and so I just tried to calm her.
Which you did.
And let her know, it's okay. The ambulance is on the way. You've fallen.
Yes.
Where she was, and started to just do some nursing checking. Okay, as I found that she was responsive, but that I couldn't really understand her, I simplified things to yes or no. Asked her about to see if I could trust her answers. I asked her if the floor was hot, and she told me no.
To have her there and be so comforting and warm and reassuring, that was a lot right there for you.
And then on the day when Mary arrived, Tama didn't know that Mary was coming. None of us who were facilitating bringing the patient to the rehab unit didn't know that Tama knew this patient. We, admit her, and the nurse who's taking care of the patient happens to be Tama, and here she goes and sees this woman and says, I know you. Do you recognize my voice? And Mary, just brightened up, and from what I understand, said, "You're my angel," or something to that effect, and recognized that Tama had been the one holding her hand at the restaurant. I think, the coincidence is, ironic in some cases, but in some ways it's just who the staff are.
I've been to Price in the other problem, and I loved it. And it's beautiful, and everyone is so nice. Can't believe it. And most everyone here. Right down to the cleaning ladies. They're polite, everybody. And they greet you. You say hello to you every time you pass them. You say your name. You know their name. It's wonderful.
It takes a team. It takes the doctor. It takes the social worker. It takes the recreational therapist. It takes the speech-language pathologist, the occupational therapist, the physical therapist, and sometimes it takes also the housekeeper and the nutritionist and, all the maintenance guys, because sometimes we'll have to think really creatively and go, okay, we need to adapt something, so we might need to bring our maintenance guys in to help make it work. So again, that comes back to our small means more. Small means that there are more people that I know in this hospital who will step up for an individual patient than any place I've ever worked before. For Tama, it was really good closure to see Mary had done well. She had gotten the appropriate medication to help with her recovery. She was going to do well, and it was really fulfilling for Tama. And I think for Mary, it was great because she had an opportunity to say thank you.
Right. the think that where I was, how I got over there, the friends I had with me, and then we have this little one show up. That's like a miracle. See? Ain't been real.